Well, good morning, everybody. We'll call the Health Services Committee meeting to order. Can I have a motion to approve the minutes of the last meeting? Supervisor Runyon, Supervisor Bruno, second. Any questions? All in favor?
Aye.
Approved. Next is privilege of the floor. Anybody from the floor have anything they would like to discuss or bring to light for us? Okay, I guess not. So seeing none, Ms. Park, it is your floor.
Good morning.
Morning.
So mine should be pretty quick.
Atta girl.
With your permission, I'd like to do all of them together because they are basically all together. It's 5 agreements. Last year, we asked permission to enter into an agreement with the St. Lawrence County Health Initiative and the North Country Healthy Heart Initiative Network to provide referrals for the chronic disease self-management program to assist them with that. And now we're asking permission to actually provide the program itself and do the education piece. So all 5 agreements, which are all 3 of these resolutions, are basically part of that.
All right, is that all right with the committee? Okay, someone make a motion to bring it to the floor. Supervisor Bruno, seconded by Supervisor Gilligan. Any questions for Dee on these? No? Hearing none. All in favor?
Aye.
Opposed? Okay, that was good. Anything else, Dee?
That's it.
Wow. That's how you do it, Kevin. You
Thank
really
you
got to
very
pick. All right, well, Dee, thank you very much. Next, Rob is up. We have nobody from health or public health this month. So Rob has a small presentation of about what, an hour, Rob? Debbie looked a little shocked there. An hour. Your floor, sir.
All right, good morning, everyone.
Morning.
So again, those that are somewhat new to me, my name is Rob York. I'm the Director of Community Services for Warren and Washington counties. And I think on the agenda this morning, I wanted to give a little update on the Warren County ARPA behavioral health projects. As you aware, Warren County had set aside $1 million initially out of the ARPA funds for behavioral health projects. And then in addition to that, added a little bit of additional funding as the process unfolded. Last meeting, Supervisor Wild did ask for an update on the projects. So what I've attached in the handout, and it might be a little different than what was originally submitted in your packet. So with the handout here, the bottom sheet is just a little summary of the projects. So a little narrative summary of each of the projects, 7 projects that we funded. And then the top sheet is what I'll go over here, and this is sort of a status update. So first project we have is the Look Media Resources, working with Jesse Jackson. Many of you know Jesse. And what Jesse's been doing, he was awarded $25,000, and that funding has been advanced to him. And for this project, video interviews, and he's been actively working with many of our local agencies, interviewing some youth. And his intention is to develop a documentary series, actually, on homelessness, mental health, and addiction, and particularly focused on youth and sort of the youth mental health crisis. And so he's and sends me periodic emails, you know, to update and say that he's actively interviewing and looking forward to a final product there. He'll make those videos available to all of our agencies and to many entities in the community that could use them to help raise awareness of these issues among the youth population. The second project was Adirondack Employee Assistance Program. They were awarded $26,000. And this was to purchase and utilize a health and wellness platform called My Life Expert. And they did purchase this and have been using it with many of the various entities that contract with Adirondack Employee Assistance Program, including Warren County. So if you read the Warren County EAP newsletter, you might have seen My Life Expert referred to. And it's a platform, that people can sign up for an account, and then you go in and it sort of prompts you to develop goals and plans related to wellness and that sort of thing.
Rob, where are they out of?
Adirondack EAP is the employee assistance program that the county contracts with for our county employees for EAP services. And then also a number of the businesses in the community contract with them. But they're located here on Glen Street, across from Crandall Park.
Thank you.
Third project was kind of a unique little project, Brayton Psychological Services. This is a private practice, psychological practice in the community, and they had a therapist who had a particular interest in developing a Minecraft group, and this is like an online type of thing that they purchase a server and some software, and they use this for groups with youth. So I don't know if people are familiar with Minecraft. I'm not incredibly familiar with it, but my understanding is it's a sort of an online game type of thing where kids can go in and they have activities and they build things, and there's some cooperative activities and opportunity to utilize it in a therapeutic way. So they utilize the Minecraft and also Zoom, so people kind of get together virtually, and then there's some therapeutic activity that goes on with the therapist.
And where are they out of?
So they are located on Bay Street in Glens Falls.
Okay, thank you.
The Waite House, many are familiar with Waite House. They received a project funding of 88,000. And this project is being fully implemented. They hired a licensed master level social worker and peer to provide support. And Jason McLaughlin has been active in developing that. So that one is fully implemented. Funds are fully advanced there as well. And folks familiar with Waite House, where that's located, they have a few locations downtown.
Primary one is on Waite Street.
Wait,
Ascend Mental Wellness had a project as well that's in the process of being implemented. This is a new name for an agency you may have been familiar with previously as Warren Washington Association for Mental Health. It was rebranded a little bit. And their project was to hire some outreach personnel and really build off of a program that was called LEMERS, which was the Law Enforcement Addiction and Mental Health Referral System. And that was an online referral system where if law enforcement comes in contact with an individual in the community and they feel like they have probably mental health issues or addiction issues, but the law enforcement sort of wraps up their contact with the person, but knows that they need further follow-up, then they can make these online referrals, and the outreach team will go out next business day and reach out to the people, do follow-up, try to get them connected to services.
and where's this end out of?
And this is basically operated out of the Cooper Street apartment building that they built there on Cooper Street.
Okay, when's that?
Which brought the old DPW building.
Oh, okay.
That- I just want to back up that Waite House. It might be worth mentioning that targets a specific age group, right? I don't know what the youngest or the oldest is, but from 12 or 13 to 19.
It might
Goes
be
up to
younger than 12 or
23.
13 now.
They go up to 23 now.
Yeah, and they go up into early adulthood. Yeah.
So they get to live there and as long as they behave. It's a good program.
They've really developed a whole array of programming there related to anti-trafficking. They've obtained some grants, doing a lot of good work in the community.
Thank you.
Okay, People USA is a group that we contract with for some peer respite services. And when we talk about peer respite, this is adult services. Individuals who themselves have had history of mental illness, and they're at a point where they are able to, in their recovery and stability, be able to work and give back to others. And it's an important connection to a lot of people when they are able to connect to somebody that's been through similar experiences. In other words, maybe they've been in a hospital, or maybe they've been on medications for years, or had similar experiences. So,
And where are they out of?
and they are out of Montcalm, 6 Montcalm in Glens Falls.
Okay.
That's their peer respite house. And their ARPA project was to develop a transitional care wellness team. So in addition to the respite, this allowed them to start to do some peer outreach services as well.
Now, I have another question. Do you make sure that these people are using this funding properly, or is someone watching where this money's going and whoopsie?
Yeah, well, they submit the ARPA quarterly reports, just like every other ARPA awardee. All those reports go through the planning department. Gina Martin from planning always sends me a copy of them, so I stay aware. But yes, they're monitoring and keeping all the documentation right within the planning department.
Okay, just checking.
Yep.
See Miss Norton back there shaking her head. I get nervous.
Okay, then the Glens Falls Hospital was a rather large award for us. It was 444,000. This is to do some renovation and expansion of their crisis unit. They're expanding the crisis unit, I believe, from 7 beds to 14 beds. And at this point, we haven't advanced any of these funds. It took a while for them to get all the approvals they needed to do these renovations within the hospital, because they have to work with the Department of Health and also Department of Mental Health, Office of Mental Health. And they have finally received all those approvals though, and they're currently drawing down on some of the county ARPA funds. But the county also, the ARPA committee committed some additional funds for this project. So they're currently drawing those down first, and then they'll tap these funds.
Okay, I know where that one is.
What's the focus of this crisis? Give me a little. information.
Sure. So right now it's a 7-bed unit, and they have two beds that are separated by a door, and then 4 other beds. And primarily it's utilized by youth, but also for adults. It is a separate space from the regular ER, while people are sort of awaiting a disposition. In other words, maybe they're waiting to be, evaluated, or once they've been evaluated, they're waiting on a bed somewhere. And it just creates a more therapeutic space for them while they can.
Yeah, the reason I'm saying this, I went to a meeting last year, the year before, the hospital. And the meeting concerned youth in crisis, so to speak. And there was no place for them to go. A lot of places had shut down those units, lack of funding, I guess. And Glens Falls had a couple of beds that they really weren't, they weren't for that use, but they had no other alternative but to house those youth in there. And those are kids that are so problematic that the parents can't deal with them, whoever, the same thing. Yeah, so it's a good thing.
Unfortunately, sometimes those kids will wait there for weeks, waiting on a bed somewhere in the state. So this allows them to sort of be reassessed continually, to begin some treatment while they're there.
The crisis unit is mainly for children in difficult situations.
Mainly, they are, with this expansion, it does give them some additional adult beds and a separate space. Before, their only separate space they had was a door that wasn't ideal.
Thank you.
And then, in addition to our initial 7 projects that were funded, there was an additional 111,000 that was designated for mental health and homelessness. And so what we did is we put out an inquiry to the Continuum of Care, which is a number of local agencies that meet together and plan for and kind of channel some of the homelessness funding. And we had three agencies that were part of that group: Ascend, Open Door, and Wait House, that submitted a collaborative proposal with Wait House as the lead. And they want to fund some emergency crisis type of housing. And we're currently working with them to refine the proposal a little bit. It needed some additional detail. So we're still waiting to approve that project. And then the last one I'll mention, it's not really part of our funding, but the county did have an intention to develop mental health first aid training. And initially, I think the idea was training for the county workforce, but then it was also raised that if we were to develop this type of training, could it be made available to the community for firehouses, EMS squads, et cetera? You know, some of the entities maybe outside of the direct county workforce. And so there's a work group among the internal work group among the county put together to sort of implement this program. So it's in the process of being implemented and planned for. But it will contain both internal and external training opportunities.
Sounds like a good program.
So you can see from the amounts there, what's been advanced and what's still waiting to be advanced. And again, the largest amount that we're still sitting on is that hospital project, but that should start to flow now.
Anybody have any questions for Rob? Rob, do you have any questions for us? Thank you.
All right, and you know, as I always say, if anybody's interested in more information about anything you hear, you know, a particular project or an agency, you want to see it, want to pay a visit, you know, set up a tour, anything like that, just let me know. And actually, I brought copies of my card too for folks that.
Thank you, sir.
Thank you.
Okay.
Okay. And also today.
No,
was
I
gonna-
didn't need one.
I have one too.
There's a stack.
Those are right where it is.
Yeah. A lot of people tell me that.
What's going first?
Oh, okay.
I'm not hard to find. All right, then I was also going to do a little overview of the Office of Community Services. I thought that would be beneficial, particularly for the newer members, but it's also been a little while since I've done the overview, so it might be of interest or use to everyone. So as I mentioned, Rob York, Director of Community Services, have been in the position for this will be my 24th year as director. We'll go to the next slide.
Don't we?
Maybe.
Okay, so there's 6 employees. And this is just a chart to show you our organizational chart, myself, our office specialist, Crystal Mallory. We have a deputy director clinical, Linda Wright. We have a deputy director fiscal, who's Harry Carlson. Tracy Terry is our children and families. SPOA stands for single point of access. So SPOA is like a referral process for high level services, high intensity services for people with individuals who have a high level of need. And so Tracy coordinates those referrals for our children and family population. And then Linda Wright, as our deputy director, coordinates those referrals for adults. Linda also has duties related to assisted outpatient treatment, and she's the coordinator for those services. And I'll talk a little bit more about AOT as we go forward. But what that is it's court-ordered outpatient treatment. And then we have Carrie Wright, who is our program analyst. Okay, we can go on. We work primarily with 3 state agencies, the New York State Office of Mental Health, the Office of Addiction Services and Support, and the Office for People with Developmental Disabilities. And most of what we do and the way we're set up, organized, et cetera, is dictated in statute in New York State Mental Hygiene Law. Article 41 directs local governments or counties to either provide or arrange for preventative, rehabilitative, and treatment services for individuals with mental illness, developmental disabilities, and addiction issues. Okay, Article 41 also requires the establishment by each county of a local governmental unit given authority in accordance with Article 41 to provide or arrange for those services. The Office of Community Services, together with each respective county community services board, comprises that LGU given authority by both Warren and Washington County. So we're a little bit unique in the sense that we're the only 2 counties in the state that have gone together in this manner. We have 1 administrative office, so 2 local governmental units, 2 community services boards, but 1 shared administrative office. Warren and Washington counties have executed an intermunicipal agreement a number of years ago, which details the sharing of the 1 office. And we were carried for purposes of retirement and ease of payroll, things like that. We're carried as Warren County employees, but Washington County pays half of our administrative costs, all of our administrative costs, through an annual chargeback mechanism. Okay, our offices are located downtown on 230 Maple Street. We lease space from Ascend Mental Wellness. This is a building that they operate some day programming and some of their case management, care management programming out of. But we lease space there. It actually works out to be good space for us because we interact frequently with their care management teams. And also it puts us in between the 2 municipal centers because we're back and forth, between each county for committee meetings and such. Article 41 also requires each LGU to have a community services board. The community services board members serve 4-year terms and officers are elected for 2-year terms. We fill unexpired terms. This is a listing of our current Warren County Community Services Board. Some of these folks you may be aware of. Kim Brayton is a psychologist in private practice. Deidre Grieve is LCSW, school social worker. She also works part-time at Glens Falls Hospital in their crisis services. Holly Irian from SUNY Adirondack. Belinda Bradley is retired. Greg Canali is our Warren County Public Defender. Christina Mastriani was a recent appointment. This should be updated slide here. She was appointed as commissioner for Warren County Department of Social Services. And Sue McManus is actually the program director of the Adirondack EAP. And we have a parent representative, Cindy Wasson. And then for Washington County, again, you see a list of individuals here, some of which you may be familiar with. Article 41 in the mental hygiene law does specify that individuals of the Community Services Board are supposed to be individuals who have particular interest in the fields that we cover, and specifies a certain composition, including parents, peers, etc.
Rob, how often does this board meet?
So the Community Services Board meets monthly on the second Thursday of every month. We generally meet at 230 Maple, although we do go around and visit our different agencies that we contract with. So we try to hold off-site meetings periodically as well, just to keep the board members familiar with the services and the agencies and. their
And this is
personnel.
jointly, Washington and Warren meet together?
Yes, Warren and Washington County Community Services Boards meet jointly, but they act separately. So all their business and action is taken separately.
Thank you.
Okay. So Article 41 also requires direction administration by each LGU of the local comprehensive planning process. And this is accomplished through a subcommittee structure of the community services boards. The local services plan for Warren and Washington counties is posted on each of the county websites. We do try to maintain some pages, departmental pages on the website and keep that kind of information posted. Article 41 requires each community services board to have separate subcommittees for mental health, addiction services and recovery, and intellectual and developmental disabilities. And we have also chosen to develop a subcommittee, separate subcommittee for children and families. The subcommittees provide venues for service system planning, implementation and coordination of local services, provider collaboration, information sharing, and multi-stakeholder problem solving. The subcommittees are comprised of some of our CSB members, LGU staff, service providers, service recipients, and family members. And the subcommittees generally meet quarterly throughout the year. The Community Services Board also has 3 standing committees: a budget review committee, nominating and personnel. Nominating and personnel really meet as needed. Budget review meets every year with each of our agencies and have them submit a detailed budget to the committee for the funding that we pass through to them. All right, talking about our contracts in Warren County, we currently hold approximately $5 million in contracts with various local community agencies that provide a variety of services related to the 3 areas that I discussed. So you can see that list. Then I have a list there of contracts for Washington County. Washington County is a little bit less. Some of our funding comes directly through Warren, but is actually a joint contract with Washington. So we have services, all of the services, really, most of the services are for, anyone in the 2-county area.
And this budget doesn't include that ARPA money.
That ARPA money is specifically for Warren, yes.
Okay.
All right, let's see, some additional responsibilities for, yep.
Let's interrupt, I'm sorry. So those 2 previous slides, the 3 million and the 5 million, those are monies that are paid to you, the Director of Community Services, and then you help facilitate everything with all that money? Is that kind of what I'm understanding?
Yeah, we hold contracts with all these agencies and then they provide the services. So
Okay.
if we go back to the language of the mental hygiene law, where counties are required to provide or arrange for these services, we arrange for these services in Warren and Washington counties through contracts.
So where do they come up with the money to pay all those people on the list?
So the majority of that funding is state aid that flows through our office that we award in contracts.
So we're paying them then,
We're
that
paying
money.
them.
Got it, to offer those programs from state aid. Okay, thank you.
And you'll see a slide in just a moment about the details of that, of that funding. Okay, so we do have fiscal management reporting responsibilities because the majority of our funding is state aid. And we have to report back to the state on that. Single point of access process that I mentioned is the referral process for individuals with high levels of need. Those referrals will come through our office. We have Tracy who does children and families piece of it, and Linda that does the adults, but they work closely with all of our providers that provide those services to try to gain access for people that are being referred, try to manage people that are receiving the services. Can people be stepped down to a lower level to create an opening? That sort of thing. So they really manage the flow of access to services. The assisted outpatient treatment that I mentioned, this was Kendra's law. I don't know if people are familiar with that, but New York State has a law where people can be court ordered to outpatient treatment if they meet certain criteria related to a history of hospitalization, dangerousness that's connected to noncompliance with treatment. Agencies that are involved in certificate of need applications with the state need approval through the Community Services Board. Overall system coordination, as I mentioned, we have responsibilities for emergency removals. These are the mental hygiene law 9.45 pickup orders, police pickup orders. Someone's become a danger to themselves or others and need removal to a hospital. We also coordinate a county disaster mental health team, which kind of got a little bit stale over the COVID years. So we're looking to revitalize that team and kind of retrain, reappoint members for that team. We're involved in SAFE Act reporting. And then we also just sit on a number of regional healthcare planning and coordination structures. I put together a few pie charts here to just show a little bit. I mentioned that state aid. So in Warren County, you can see that 5 million is over 99% state aid. There is a little bit of county tax levy there. That's a kind of a leftover from cuts that occurred one year, and the county was willing to fund that to keep the agencies whole, and have continued that funding over the years. For that 38,000 that is local tax levy, we'll go to the next slide. This shows your split there. That funding goes to two of our agencies, Liberty House Foundation and Ascend Mental Wellness. And you see a similar slide for Washington County, similar split in their percentage. Over 99% of the funding is state aid, and similar split for their local tax levy for also goes to Liberty House and Ascend. Okay, then our admin costs. This is the split between Warren and Washington counties. It's slightly different because each county does pay their own statewide association dues. So that creates a little bit of a difference there. And if we look at the split on the admin funding, there's a pie chart for that. About 70% is covered by state and federal aid, because we also pull down some federal aid. And the 30% of that is local tax levy. And then there's just a few charts there as info on Washington County. We can click through those. All right, one thing that I put on your radar here that we kind of been watching closely over the last few years is an increase in court-ordered psychiatric expenses. What this is individuals who are ordered for competency examination. There's a question of their competency to stand trial. And if an individual has felony charges and they're found to be not competent to stand trial, then they're sent to a state facility for restoration services. There's a curriculum that they go through there. They, offer medication and support, that sort of thing. Primarily, it's to educate them back to competency, bring them back to competency. And basically, the standard for competency is, do you understand the charges against you, and are you able to assist in your own defense? So those are the two standards. And if these people have been found not to meet those standards, again, they go to the state facility and they receive this sort of training curriculum, educating them on the court process, the role of the judge, the role of the attorney, public defender, prosecutor, et cetera.
Rob, Supervisor Bruno has a question.
Any idea or conjecture on why the dramatic increase over the past 3 years? I mean, look at that. It's astounding.
If we go back to, I think it was 2018. So these expenses, again, the chargeback is about $1,000 a day. In excess of $1,000 a day. These are court orders, so we really have no control over them.
Right.
Once they're in there, the state is making the determination when the individual is ready and have been restored. So it's kind of a conflict of interest, I think, because they're the ones, what's their incentive to send the person back today versus next week, they're making $1,000 a day. These expenses used to be split 50-50 between the state and the county. And I think it was 2018, they changed that and they made it 100% county responsibility. So
100% county responsibility, but they're dictating who and how long.
that's what I mean. It doesn't make sense to me that they would be the ones to make that determination, but. So I think that's part of why you see the dramatic increase. But even given that, even if you see those prior years, double those figures, and it's no way near what we're seeing, so.
I just wondered if it was a societal thing or.
It probably is. Some of the courts got backlogged during COVID too, so there are some belief or feeling that some of these are just backlogged cases,
So, Mr. York, are you saying that when somebody becomes incompetent, then they get sent to this state facility, it's $1,000 a day for them to be at this rehabilitating state facility?
Yes, and that $1,000 a day gets charged to the county, and that there's no ability to apply the state aid toward that. That's 100% county tax levy.
It's a lot of money for a day. Thank you.
There has been some work within NISAC. Our statewide association has been working within NISAC, trying to advocate for some reform to the process. I think there's a bill pending currently to make some changes. There's also some exploration and discussion of developing outpatient restoration programs, and maybe some portion of these folks could be kept local and just restored to an outpatient program.
This just gets added to a long list of unfunded mandates.
Yeah.
From the state. All the unfunded, I don't mean to preach, unfunded mandates, and then they grab your sales tax and everything else and get their hands. I feel better.
As long as you feel good, I'm fine. Supervisor Pritchett.
Yeah, and Mr. York, once they get deemed competent by the state, do they stand trial for their offense? Okay, thank you.
They do, once they're deemed competent, they come back and the process picks right up with the prosecution of the, standing for their charges.
Thank you.
Thank you, Rob.
Okay. So again, I think that's it. You see similar pattern, for Washington County, that spike in the last few years.
Nope. Thank you, Rob. You're all set?
I'm all set.
Okay, first, do we have any comments or questions from the public that would like to ask any questions about any of this? We do have one.
I'm just
Treasure-
curious, thank you.
You need to get to the podium though.
Yes.
Thank you.
Very interesting, thank you for that. The difference between Washington County and Warren County definitely spiked. Why do you think Washington County just had 1 year, but they're fairly consistent in the other years?
Again, it just seems to be so variable. It's really something hard to tell. We really don't know.
Is there any recourse to going back to the state and challenging something?
Well, there's been an advocacy really over the years since they, pushed it to 100% county. Without any success. Again, our statewide association of county mental health directors is working with NISAC to try to develop some reform. Earning to 50/50.
Thank you.
Okay, anybody else? Well, Rob, thank you very much for the
Thanks, Rob.
presentation. I think it helps the committee and helps everybody that was here understand what we go through. On that, the committee, anyone else have anything they'd like to bring to the floor? Okay, can we have a motion to adjourn? Supervisor Bruno, Supervisor Runyon, all in favor?
Aye.
Hey, I'm right.